Hi everybody. So today we're here in the office and we're going to be doing a procedure called bioidentical hormone replacement. And we're working with a company called BioTE. And the patient came in because she's having some severe symptoms. She's got some hot flushes, she's got some sleep issues, she's got some memory fog. And the goal is to kind of make her feel better. And the goal is we're going to be doing this with bioidentical hormones. And we're going to be using these tiny, tiny little pellets in here. The pellet is going to go somewhere right about in here. So first thing we're going to do is we're going to locate where we're going to make our little incision. We're going to clean the area with some alcohol. Then after we clean the area, we're going to inject some numbing medication. A little uncomfortable, a little pinprick, and then we're going to let that medication kick on in. So now that the area is all numb, next thing we're going to do is we're going to make a little incision where the skin is. And this is where we're going to be placing our trocar for the pellets. And we're going to basically place the trocar right into where our incision is. We'll place it inside, just so that it enters the skin, and then angling upward, we're going to twist it. And she has no pain at all. Next thing we're going to do is we're going to get our pellets, and we're going to push the pellet forward. Next pellet. Okay. I'm going to push that pellet forward. Next, we're going to take our little driver, and with a little bit of pressure, we're just going to push the pellets in, and then we're all done.